Hi everyone, welcome back to my channel. Let's take a look at this question. The nurse performs medical reconciliation for a 94 years old client who has type 2 diabetes, hypothyroidism, and heart failure, which caused by a previous myocardial infarction. Due to leaks outweighing benefits, the nurse plans to take Due to leaks of outweighing benefits, the nurse plans to talk with the healthcare provider about discontinuing which medication. You know, this patient has a multiple medical condition, right? And this patient has been taking multiple medication because of the condition. Then, because of the age, the population, you have to pay attention to the age. 94 years old. So, due to the risk of outweighing benefits, the nurse needs to discontinue one of the medication. Which medication is that? All those medication is very important for this patient. But because of the population, because of the age of this patient, because of the risk outweighing benefit, they need to stop just one medication. You can be able to select the correct option if you know how this medication and know their benefits and know the adverse effects. If you know the signs and symptoms and the adverse effects and the mechanism of action of these 4 medication, you can be able to select the correct option. Before you start, you have to pay attention to the modifiable phrase, which is the population, the year. 94 years old client. This is an elderly patient. And this patient has type 2 diabetes, hypothyroidism, heart failure. All these things, heart failure, which cause with myocardial infarction. This patient has been suffered myocardial infarction before. And this patient has this medication. Number 1 says aspirin. It's 1 milligram per oral once a day. Number 2, furosemide, Lexis, 40 milligram PO once a day. Number 4, glyburide, 10 milligram PO once a day. Levothyroxine, 50 microgram per oral once in a day. All this medication is very important based on this patient condition. Let's start to eliminate. Always make use of the power of elimination. Your elimination techniques will always help you to select the correct option. So let's talk about the condition now. All this condition is very important, right? There are some conditions here. If you did not give the medication, the condition of this patient will get worse, right? Let's start from below to the top. So let's talk about levothyroxine, 50 microgram. And let's talk about the hypothyroidism. A patient that has hypothyroidism needs levothyroxine, right? And this patient is supposed to take this medication for life. So you cannot discontinue this medication. We eliminate levothyroxine. The patient needs this medication because of this condition. So let's go to number 3. Glyburide, 10 milligram. This medication is an anti-diabetic. Number 3 medication is given to a patient who has diabetes, right? So the question is, are you gonna discontinue this medication, or will you continue giving this medication to this patient? They did not tell us the level of the glucose level. We are not going there. We don't want to include question which was not asked. Since we get confused in number 3, let's go to number 2 option and see if we can discontinue or keep the medication to the patient. Number 2 says furosemide Lexis, giving 40 milligram PO once in a day. And this patient has heart failure. For someone that has heart failure, that patient must need furosemide. For a patient who is suffering from heart failure, they must need furosemide Lexis. So number 2 is eliminated. We are taking number 2 off because the patient needs that medication. Yeah. As you are doing this, always pay attention to the last sentence. Due to risk outweighing benefits, the nurse plans to talk with the healthcare provider about discontinuing which medication. As you are trying to select the correct option, always pay attention to the last sentence, which will help you to select the correct option, and also it will help you to prevent mistake. You see, this patient needs number 2 medication. So let's go to number 1, aspirin. You know what aspirin is? Aspirin does a lot of things, and remember, this patient has already have myocardial infarction. So this patient is prone to blood clots. So we are not gonna eliminate this. This patient needs this medication, right? So I'm gonna leave you to select your option from number 1 and number 3. Yeah, not minding that the patient needs number 1 medication and also needs number 3 medication, but there are 1 medication that you need to discontinue because that medication will affect the patient age. There are some things that medication is doing to this patient that we need to stop. That is why the risk outweighing benefit. So guys, select the correct option, drop it in the comment section. I will come over to the comment section to drop the rationale. Remember, you can, you will, and you must pass your Nclex exam. Awareness is the key. Do not get it twisted. See you guys in my next video. Bye for now.